My name is Ann Ruck, and I am the Director of Professional Development and Education at Central Jersey Family Health Consortium. We, along with the other two maternal child health consortia, the Southern New Jersey Perinatal Cooperative and the Partnership for Maternal and Child Health of Northern New Jersey, are working in collaboration to enhance new parent education to reduce the risk of sudden, unexpected infant death in New Jersey. I would like to take this opportunity to introduce you to the three nurse educators who are working together on this initiative. Jamie Agunze is a nurse educator with Central Jersey Family Health Consortium. Jennie Sherlock-Loeb is the Director of Education at Southern New Jersey Perinatal Cooperative, and Sarah Mueller-Robbins is the Director of Clinical and Professional Education at the Partnership for Maternal and Child Health of Northern New Jersey. We'll talk briefly to you today about the importance of this initiative, as well as how we can bring this education to you.
Thanks, Anne. Promotion of safe sleep practices has been shown to reduce sudden unexpected infant death and sudden infant death syndrome. But while many gains have been made in reducing the rates of SUID, these rates have leveled off after an initial decline. In other words, we've made great gains, but in order to continue to decrease the number of families that experience this type of loss, we need to do better and different work. This means it's important to address other factors that contribute to sudden unexpected infant death and sudden infant death syndrome. There are other risk factors in addition to unsafe sleep practices that put families at risk of losing a baby to SUID and SIDS, and many of these are related to health disparities and social determinants of health. Infant loss to SUID and SIDS is impacted by a family's ability to gain access to quality and timely health care. Families that live in poverty have less access to prenatal care, greater foods insecurity, poorer health over the lifespan, exposure to higher crime rates, stress, and bias. Babies that are born prematurely experience SUID and SIDS at higher rates than infants who are born at term. Other risk factors include exposure to adverse environmental conditions like tobacco smoke. Babies who are exposed to smoking, either from the birth parent or others living in their environment, have a greater risk for SIDS. Research estimated that if no women smoked during pregnancy, SUID rates would decline by 22%. Finally, there's evidence to show that experiencing the stress of racism, discrimination, and implicit bias puts families of color at risk for losing an infant to SIDS. While we must remain vigilant about practicing and promoting safe sleep, we must also help the families we serve by addressing systemic inequities that contribute to the loss of too many newborns in our state.
The Maternal Child Health Consortia are pleased to be able to offer multiple opportunities to engage with your staff and provide them the most updated and evidence-based education that is available. In partnership with the SIDS Center of New Jersey, we have developed several options for safe sleep education. We are happy to join you and your staff at pre-existing staff meetings. We can attend both in person or virtually and can share vital information in as little as 15 minutes. If you are interested in a more asynchronous option to reflect the varying schedule needs of your team, we have also created a poster presentation that can be delivered to your unit for a period of time. The poster includes infographics, safe sleep education tips, and QR codes for additional resources. We will work with you to track staff engagement with the poster. We understand that now, more than ever, support for education is needed. We are proud to serve your organization and staff with meeting both their continuing education requirements and professional goals.
We are happy to also be able to offer an on-demand webinar for nurses and other health professionals who work with young families on the updated 2022 AAP recommendations for reducing infant deaths in the sleep environment. Professionals have an opportunity to learn directly from Dr. Barbara Osfeld, Program Director of the SIDS Center of New Jersey and a nationally recognized expert on sudden unexpected infant death, in an hour-long presentation that can be viewed at any time on demand.
We look forward to engaging with each of you. Our contact info will be on the screen. Please reach out to the Maternal and Child Health Consortia within your region.